Are you managing diabetes and wondering which vitamins could actually make a real difference? You're not alone. In this video, we're diving into the top 3 essential vitamins every diabetic should know about, the ones that go beyond the basics and actually support your blood sugar, nerve health, and energy levels. Whether you're dealing with fatigue, tingling in your hands and feet, or stubborn sugar spikes, these vitamins might just be the missing piece in your routine. Let's break it down in a way that's clear, science-backed, and super practical. Let's get into it. 1. Methylcobalamin, vitamin B12. In people with diabetes, a deficiency in methylcobalamin, an active form of vitamin B12, can show up in some unique and sometimes sneaky ways. One of the most telling signs is worsening nerve pain or numbness in the hands and feet, which can be confusing because diabetes itself can cause neuropathy. But when B12 is low, the nerve issues can get noticeably worse and don't improve just by managing blood sugar. Some people start to lose their balance, especially in the dark or with their eyes closed, due to nerve damage in the spine. Others might feel foggy-headed, forgetful, or unusually down, often brushed off as stress or aging. A swollen, red, burning tongue or a strange burning feeling in the mouth can also pop up, which is pretty specific and not something you'd usually see with other vitamin deficiencies. One big reason this happens is that metformin, a common diabetes medication, can mess with B12 absorption, so even if someone eats well, they might still be running low without realizing it. Methylcobalamin deficiency in people with diabetes is more common than many realize, and several factors contribute to it, some with surprising stats. One of the biggest triggers is metformin, a frontline diabetes drug. Studies show that up to 30% of people taking metformin for more than 4 years develop a vitamin B12 deficiency. Even at lower doses, about 10 to 20% can show reduced B12 absorption. Add in age, and the risk climbs. After age 60, around 15 to 20% of adults are B12 deficient, even without diabetes. Diet matters too. Strict vegetarians and vegans who don't consume animal products are particularly vulnerable, since B12 is found almost exclusively in meat, fish, eggs, and dairy. Then there's the stomach's role. Conditions like atrophic gastritis, which affects 10 to 30% of older adults, or the use of acid-suppressing medications like PPIs and H2 blockers, taken by over 15 million Americans daily, can quietly impair B12 absorption. Another lesser-known cause is pernicious anemia, an autoimmune issue that affects around 0.1% of the population, where the body can't produce intrinsic factor, a protein needed to absorb B12. Fun fact, the liver stores several years' worth of B12, so symptoms can creep in slowly, sometimes taking 3 to 5 years to show up after absorption starts dropping, making it a silent but sneaky issue. Methylcobalamin deficiency can hit several major systems in the body, especially in people with diabetes, and it works its damage both physically and deep at the cellular level. One of the most noticeable effects is on the nervous system. About 50 to 60% of diabetics already deal with some form of nerve damage, and low B12 makes it worse by disrupting myelin, the protective coating around nerves, leading to pain, tingling, or even loss of balance. At the cellular level, B12 is crucial for DNA synthesis and red blood cell production, so a deficiency slows cell repair and leads to macrocytic anemia, where red blood cells grow too large to function properly. This can cause fatigue and weakness that feels out of proportion to blood sugar levels. In the brain, low B12 affects neurotransmitter balance and can shrink brain volume over time. One study found that people with chronic low B12 had 6 times the risk of brain atrophy. The cardiovascular system is also at risk because B12 helps break down homocysteine, an amino acid that, when elevated, can damage blood vessels and raise the risk of heart disease. Up to 30% of B12 deficient diabetics show high homocysteine levels. Even the gut doesn't escape. B12 deficiency can damage intestinal lining and reduce appetite or nutrient absorption, creating a spiral of worsening health. All this from a vitamin you only need in micrograms, a tiny dose with a huge impact. Overcoming methylcobalamin deficiency is usually pretty straightforward once it's caught, and the results can be surprisingly quick. For most people, taking oral B12 supplements, often 1,000 to 2,000 micrograms daily, is enough to restore healthy levels, especially if they're still absorbing some B12 naturally. But if the deficiency is severe or symptoms are intense, doctors may start with B12 injections, which bypass the gut and go straight into the bloodstream. These are usually given once a week for a month, then monthly as maintenance. Interestingly, people with nerve symptoms often report feeling better within a few weeks, especially with injections. For those on metformin, some studies suggest adding calcium, around 1,200 milligrams daily, can actually help improve B12 absorption, a cool little side trick. If a poor diet is the cause, simply adding more B12-rich foods like eggs, fish, and dairy can help, though vegetarians and vegans usually need to supplement. The best part? Unlike many vitamins, there's no upper limit for B12, so it's safe even at high doses, because any extra just leaves the body through urine. Regular testing, especially for those over 60 or on long-term metformin, can catch the problem early before symptoms get worse. To correct a severe B12 deficiency within a month in diabetics, food alone usually isn't enough, but loading up on the richest sources can still help alongside supplements. The top food source is beef liver, packing a massive 70 to 80 micrograms of B12 per 3-ounce cooked portion. That's over 3,000% of the daily value, so just one serving a week can make a dent. Next is clams, with 84 micrograms in just 3 ounces, making them one of the highest natural sources out there. Sardines come in third, offering 7 to 9 micrograms in a 3-ounce can, plus a bonus of omega-3s, which are great for heart health. Salmon is another star, delivering 4.8 micrograms per 3-ounce cooked fillet, and it's especially good for diabetics thanks to its anti-inflammatory fats. Finally, fortified nutritional yeast is a vegan-friendly powerhouse. Just 2 tablespoons give around 8 to 12 micrograms, depending on the brand. Eating these foods several times a week, combined with a daily B12 supplement, 1,000 to 2,000 micrograms, or injections for faster results, can help restore levels quickly, even in people with poor absorption from metformin or age-related decline. Second, folic acid, vitamin B9. If you have diabetes, you might not realize that a deficiency in folic acid, the synthetic version of folate, can quietly mess with your health in ways you wouldn't expect. Now, most people think of folate as just something you find in leafy greens like spinach, but folic acid is the form used in supplements and fortified foods like cereals and bread. It sounds simple, but here's the catch. The body has to convert folic acid into its active form, L-methylfolate, to actually use it. The problem is, not everyone's body does this conversion well, and for diabetics, it can be even trickier. If you're one of the 10 to 15% of people with a genetic variant, the MTHFR gene mutation, your body might struggle to make that conversion, even if you're taking folic acid supplements or eating folate-rich foods. So you could be getting plenty of folic acid, but still not be able to use it properly, leaving you with a hidden deficiency that's tough to catch. So how does this show up in people with diabetes? First off, you might notice that you're feeling more tired than usual, and we're talking about all the time fatigue, not just feeling wiped after a long day. It can make it hard to focus, feel mentally sharp, or stay positive. This brain fog can also leave you feeling forgetful or disconnected, something that can really get in the way of managing diabetes. And here's the thing. Folic acid also has a huge role in nerve function. So if you already have some nerve damage, neuropathy from diabetes, low folic acid can make that pain, numbness, or tingling feel a lot worse. It's like putting a magnifying glass over nerve problems you already have. But here's the real kicker. Folic acid deficiency has this weird ability to mask another serious deficiency, B12. This is especially important because B12 is crucial for nerve health, and a B12 deficiency can lead to irreversible nerve damage if not caught early. If you take too much folic acid, it can make the symptoms of B12 deficiency harder to spot, which might lead to even more nerve damage before you realize it's happening. So when it comes to folic acid, it's not just about how much you get, It's about making sure your body can actually use it. Now let's dive into why diabetics are especially at risk for folic acid deficiency. For one, metformin, the go-to drug for diabetes, can lower folate levels by about 15 to 20%, especially when taken over long periods. Then add in insulin resistance, which a lot of diabetics face, and suddenly folic acid becomes even more important. You see, folic acid is key in breaking down homocysteine, a substance that, if too high, can damage your blood vessels and raise the risk of heart disease and stroke. In fact, studies show that 40 to 50% of diabetics with low folic acid also have high homocysteine levels, which means they're at a higher risk for cardiovascular problems. So folic acid isn't just for nerves and energy, it's crucial for heart health too. Aging doesn't help either. After 50, the body's ability to absorb and convert folic acid drops by 10 to 15%. So if you're a diabetic over 50, you're already more likely to have lower folate levels, even if you're eating your leafy greens. This becomes a bigger problem when you consider that up to 25% of people over 70 have low folate levels, even without diabetes. Add in the MTHFR gene mutation, and your body's ability to handle folic acid drops even further. In short, the older you get, the harder it gets for your body to use folic acid. And if you're diabetic, you're at an even higher risk. When folic acid levels are low, the effects show up in several systems. The first noticeable effect is usually on the brain and nervous system. Low folic acid can interfere with the production of important neurotransmitters like serotonin and dopamine. This can lead to depression, anxiety, and even cognitive decline. In fact, studies show that people with low folate levels are 2 to 3 times more likely to develop mood disorders or cognitive impairment than those with normal levels. And it's not just about mood. Folic acid is needed for DNA synthesis and cell division. So without enough, you end up with fatigued, oversized red blood cells that can't do their job properly. This results in megaloblastic anemia, which makes you feel exhausted and weak, even if your blood sugar is in check. If you're looking to correct a folic acid deficiency, there are some great, easy-to-access foods that can help you out. Fortified cereals are a top contender because they are packed with folic acid. Just 1 cup can give you anywhere between 100 to 400 micrograms, which is a solid chunk of your daily needs. For a more natural approach, leafy greens like spinach and kale are packed with folate, the natural form of folic acid. A cup of cooked spinach gives you about 260 micrograms of folate, which is more than half of what you need in a day. If you're a fan of legumes, lentils are a great option too. A single cup of cooked lentils contains about 350 micrograms of folate, plus they're high in fiber and protein, helping with blood sugar control. Another simple way to get your folate is from citrus fruits like oranges. One medium orange provides around 40 to 50 micrograms, plus vitamin C to support your immune system. And for those following plant-based diets, nutritional yeast is a vegan-friendly powerhouse, giving you 8 to 12 micrograms per 2 tablespoons, depending on the brand, and it's a great way to add a cheesy flavor to dishes without any dairy. If food alone isn't cutting it, supplements are a quick fix. Folic acid supplements typically come in doses of 400 to 800 micrograms, which is the recommended amount for most people. But if you're someone with an MTHFR mutation, where your body struggles to convert folic acid into its active form, L-methylfolate is the better option. It bypasses the conversion process and gets straight to work. For more severe cases of deficiency, you might need to start with 1,000 micrograms daily, but always check with a doctor before upping your dose. One interesting thing is that if you have high homocysteine levels, a common issue in diabetics, increasing folic acid can lower those by 20 to 30%, reducing your risk of heart disease. It's not just about energy or mood either. This little vitamin is also crucial for nerve health, especially if diabetes has already caused some nerve damage. So, a mix of folate-rich foods along with the right supplements can help restore balance in about a month. But keep in mind that regular blood tests are important to monitor progress and ensure you're getting enough. Interestingly, folic acid isn't stored in the body, so any extra just gets excreted in your urine. This makes it generally safe, but high doses over time, especially over 1,000 micrograms daily, might cause some issues, particularly for people with kidney problems. It's also worth mentioning that if you're diabetic and have high homocysteine levels, getting more folic acid through supplements or diet can actually help lower those levels by 20 to 30%, which is a win for heart health. At the end of the day, fixing your folic acid deficiency is all about getting enough of the right form and ensuring your body can actually use it. Regular blood tests, especially if you're older, on long-term medication, or struggling with fatigue or mood issues, can help catch a folic acid deficiency early. CHEDI PET P, vitamin B chest. P5P is the active form of vitamin B6, and it's the version your body uses directly. Unlike other forms of vitamin B6, like pyridoxine, which needs to be converted in the liver to become usable, P5P bypasses this conversion and is immediately available for metabolic processes. This is especially important because up to 30% of people with liver dysfunction or certain genetic conditions, like MTHFR mutations, may have difficulty converting pyridoxine into P5P, making direct P5P supplementation more beneficial for these individuals. In fact, P5P is about 5 times more bioavailable than the standard form of vitamin B6. For diabetics, P5P plays a crucial role in regulating blood sugar levels and insulin sensitivity. One of the key functions of P5P is its involvement in the glycogen breakdown process. When you eat food, glycogen in the liver and muscles is broken down into glucose, and P5P helps this process along. This means P5P supports glucose metabolism and helps ensure that your body uses glucose efficiently, preventing spikes and dips in blood sugar. On a cellular level, P5P supports insulin secretion and helps with the function of insulin receptors. This means it aids in improving insulin sensitivity, an important factor for those with insulin resistance, which is a common issue in type 2 diabetes. Research suggests that vitamin B6 deficiency, and thus P5P deficiency, can lead to insulin resistance and difficulty in regulating blood sugar. In fact, studies show that 50 to 70% of individuals with diabetes exhibit some degree of vitamin B6 deficiency. It's particularly prevalent in people who are on long-term metformin therapy, as metformin can impair the absorption of vitamin B6, which affects P5P levels. P5P is also essential for nerve health, a major concern for diabetics, as peripheral neuropathy affects up to 50% of people with diabetes. P5P plays a significant role in nerve repair and protecting the myelin sheath, which insulates nerves and helps them transmit signals. Low levels of P5P can exacerbate nerve damage, leading to worsened tingling, numbness, or burning sensations in the hands and feet. Studies have found that supplementing with P5P can help improve nerve function and reduce these symptoms. In one clinical trial, diabetics with neuropathy who took 100 milligrams of P5P daily showed significant improvements in pain and nerve function. At the molecular level, P5P is involved in amino acid metabolism, which is essential for protein synthesis and neurotransmitter production. It aids in the production of serotonin, dopamine, and GABA, all of which are crucial for mood regulation. This means that P5P deficiency can lead to depression or irritability, which is common among those with diabetes. Research has indicated that vitamin B6 deficiency is strongly associated with increased anxiety and depression, and correcting it with P5P supplementation can improve mental well-being. Another significant benefit of P5P is its role in reducing homocysteine levels, an amino acid linked to cardiovascular disease. Homocysteine is elevated in many people with diabetes, and high levels can cause damage to the blood vessels, increasing the risk of heart disease and stroke. P5P is involved in converting homocysteine into methionine, an essential amino acid, and therefore helps keep homocysteine levels under control. A study showed that 50% of diabetics had elevated homocysteine levels, which were significantly reduced after supplementing with P5P. For food sources, the best options include tuna, salmon, chickpeas, potatoes, and bananas. For instance, just one serving of tuna, about 3 ounces, can provide 1 milligram of vitamin B6, which is approximately 50% of your daily requirement. However, P5P supplementation may be necessary for those with higher needs or absorption issues. Typical supplementation doses for P5P range from 25 to 100 milligrams per day, depending on the severity of the deficiency and individual needs. Higher doses up to 200 milligrams may be recommended by doctors in cases of severe deficiencies or for individuals with significant nerve damage. Interestingly, unlike many vitamins, P5P has a low toxicity and there's no established upper limit for intake. However, very high doses, over 500 milligrams per day, can lead to nerve damage in rare cases, so it's essential to stick to recommended doses unless supervised by a healthcare professional. For diabetics, supplementing with P5P can lead to noticeable improvements in both physical and mental health, especially when combined with a balanced diet. It helps not only with managing blood sugar, but also supports nerve health, mood regulation, and even cardiovascular health. Just remember, if you're on medications like metformin or have any underlying conditions, it's a good idea to check in with your doctor before starting supplementation. If you found this video helpful, go ahead and hit that like button. It really helps us reach more people who might need this info. Don't forget to share it with friends or family who are managing diabetes too. They'll thank you for it. And if you want more clear, practical health tips like this, subscribe and turn on the bell so you never miss an update. Thanks for watching and take care of your health, one smart choice at a time.